Thanks, Kate, and welcome everybody, and good afternoon from, for a change, sunny Ottawa. As most of you know, Families Canada launched this series in response to COVID-19, and our intent was to have those in the family support sector able to connect and to share, and of course to learn from each other and from, of course, our speakers. And as mentioned, this session on mental health and youth is the last in our 10-part series. So our final speaker today is Dr. Ian Manion, and Ian is a recently retired clinical psychologist and science practitioner who has worked with children and youth and families for some 35 years plus. And Dr. Manion has also been an active researcher in mental health systems of care, youth depression, and suicide. And he has a particular interest in youth engagement and how services are organized to best meet the needs of youth, mental health needs of youth in particular. And Dr. Manion is certainly a committed advocate for children and youth mental health, both in Canada and internationally, which is something that I can attest to personally through our past work together. And he's the co-founder of YouthNet, or Réseau Ado, a bilingual community-based mental health promotion program with satellites that are all across Canada. And as a person with lived experience, in 2018, he also served as a spokesperson for the Bell Let's Talk campaign. And with that, it's over to you, Ian.
Thank you very much, Kelly. It's my absolute pleasure to be here, and thanks for the invitation. I just wanted to start by hoping that everyone is well and are able to both offer and receive support and cope during these difficult times. I'm going to be talking about youth today, and I guess I almost have to define youth for people before we start. And what I'm referring to, I mean, sometimes people refer to youth, anyone between the ages of 12 and 25, or even as high as 29. I'm going to be focusing more on that 13 to 19 years of age kind of a window. And as I'm looking across the screen with all these boxes, I'm actually seeing some familiar names and some people I haven't seen in a while. So thanks for it's nice to see those names again, and perhaps we'll hear some questions from you a little bit down the road. One thing I really want to stress from the beginning is that when we talk about youth, there's not one singular type. Youth are different, and we have to be very sensitive to their differences. They're different in very many different ways. They have different styles, different needs for social contact, for social support, different styles of communication. They have different strengths in terms of their coping skills, both adaptive and maladaptive coping skills. Some of them have extensive support networks, some of them don't. Some of them have very few supports. Some are dealing with other issues, and they could be health-related, physical, mental health issues. It could be issues of inequities because of a subgroup that they may be part of, whether they are homeless or street youth, whether they are new Canadians, Indigenous youth, or youth that might be viewed as less mainstream in many different ways. And those can also represent significant challenges. So COVID-19 has kind of turned us all upside down. And I think we've realized in many ways how hard it is to run our traditional systems during this kind of a crisis. But we're also learning that perhaps our traditional systems don't meet all the needs of those we're trying to serve. I particularly work in the mental health system, and we've known for years how broken it is. And this has put a spotlight on that in many different ways. Generally speaking, youth that have already been struggling with something, whether it's a physical health or a mental health concern or a school-related issue, actually have had more difficulty coping during the pandemic. Everything's a little bit more difficult than it was before. There have been so many surveys done in terms of how young people are coping, what their mental health status is during this pandemic. And pretty much all the things that I've read are saying that anxiety is significantly up. Young people are questioning, they're having more anxiety than they've had before. And anxiety is already the most common mental health concern that we see in young people, sometimes by itself or sometimes in combination with other things, being an eating disorder or being a learning disability or being an externalizing disorder, whether it's conduct or attentional problems. So all those who had problems seem to be having more problems, and anxiety is up pretty much across the board. The good news, though, is when we ask young people, even though they're a lot more anxious, how are they coping? The vast majority are saying they're coping well. They've had to change many, many, many things, but the vast majority are telling us that they're coping well. But what are they anxious about? What are they worried about? Well, they actually are worried about health. They're worried about COVID and who's catching COVID, but they're not necessarily worried about themselves catching COVID. They're worried about their parents. They're worried about their grandparents. They're worried about others in general, but they aren't necessarily worried about themselves. Now, you need to understand that from a developmental perspective. During adolescence, we know that the brain changes. The adolescent brain is very different. It's much more impulsive. We act before we think. One person has characterized this as that you have this adolescent who's been given a brand new Ferrari to drive, but they haven't learned how to drive yet. So they have all these abilities and things going on in a brain that processes things not necessarily the same way that we process things, including risk. So there's a bit of a sense of vulnerability around this. And I'll tell a story, which is not a great story. I was waiting in line at a store with a mask on, and I was socially distancing. And there was a young man and his girlfriend who came like 6 inches away from me. And I said, excuse me, would you mind just, we're trying to practice social distancing. And he says, is that because of that COVID thing? And I said, well, yes. He said, well, do you want me to do this for you, or do you want me to do this for me? I said, well, I think we're doing it for everybody. He says, yeah, but the reality is you're going to die first because I'm young, I'm not going to get it. So his view was, I'm invulnerable. Even if I got it, nothing's going to happen to me. So why should I worry about taking any precautions? So that risk taking that we see sometimes comes into play around COVID. A lot of young people are afraid of the state of the world. Things have changed. And in all honesty, we'll probably never go back to exactly the way they were before. Things are different now. And sometimes that's going to be good because some of our systems that weren't working really well have had to adapt and evolve much more quickly than they would have otherwise, including our mental health system. But it's going to be different. And young people are wondering, what does that future hold for me? What does it hold for me in terms of education? What does it hold for me in terms of employment? What does it hold for me in terms of how I interact with people I care about? Can I still travel the world? That was one of my dreams. I want to travel the world. So some young people are experiencing a sense of loss, things that they were looking forward to, especially those that are in a transition period where you have a lot of rites of passage, like graduations from high school or about to transition into college or university. That's very different now. It's not very clear what's going to happen. If you happen to be someone that's struggling and now you have to learn at home, can you learn independently? And are your family resources there in such a way that they can actually help you learn? Or is it also a stressor for the parents in terms of also having to maintain a job or find a way of keeping the family going while you're teaching your adolescent? So financial concerns abound. Think about it, summer's coming up. Most adolescents or many adolescents are looking for summer jobs. What happens this summer? What happens if the only way you can go to college or university or afford it is if you pay your way? What happens if your family is also worried about finances and now there's no guarantee that they can support you in the next step of education? Now, those young people that do have jobs, think about where they work. Probably the lower paying jobs, very few health benefits, usually dealing with the public, so they're in higher risk. Well, how does that impact a young person's anxiety and their ability to cope? And how many of those young people actually have a choice? Because they have to contribute to a family sometimes. So that's another issue that we're seeing. School is huge. I read one study that 75% of youth are saying that they actually miss school a great deal. They don't all necessarily miss the school work, but the school is a hub of so many things. Socialization, learning, progression, career paths. Schools are also an avenue for receiving support. Some young people cannot get support anywhere but at school, sometimes for cultural reasons or geographic reasons, and now that may not be as readily available to them. So accessing help when necessary, there's one extra piece now that's made it a little bit more difficult. One thing that we have been hearing a lot because of social isolation, families are spending a lot more time together than they ever have before. That's a two-edged sword. In certain families, it's a wonderful opportunity to reconnect and to value each other and to see each other. In others, where there may be already tension or conflict or difficulties, whether it's communication or parenting or dealing with rebellious behavior, whatever it happens to be, it can accentuate existing problems within the home. Add to that young people that are anxious, parents who are also anxious. Don't forget, it's hard being a parent. It's extremely hard being a parent in the best of times. Now we've added parents, not only do they have to be parents and earn resources to keep the families going, they have to be teachers and mental health professionals supporting families in every way and the young people in every way possible. So we're seeing an increase in concerns about being able to parent effectively during a pandemic, especially with youth. One of the concerns we hear, and again, think about that adolescent brain that's in terms of risk-taking behavior. If they want to engage or don't see themselves as at risk, what does a parent do when their young person wants to go out and do whatever they want, doesn't want to socially isolate, wants to go hang out with their friends, even when they're told not to? How does a parent deal with that? Is it command and control, or is it something that you negotiate with your young person? So the conflicts can increase, but again, most families are doing extremely well, and they're looking at this as an opportunity to find better balance in everything that they do. Some young people suffer more because of social isolation because they need peers more. Others don't need peers as much. And actually, it's a way for them to feel a little less atypical because maybe they're more solitary in nature. What happens when this does change? And we have to look at reintegration into work, into school, into community. Some young people have more difficulty than others because of their coping styles, their support networks, their communication styles. We don't have to think about just the now. We have to think about the down the road. What does the new normal look like as opposed to the return to normal? It's going to be a new normal. We are using technology more than ever before, hence the way we're doing this today. Great, we're learning all kinds of things. Virtual care has exploded. There's so much going on now where service providers are trying to find ways to provide virtual care. Not every young person feels comfortable with virtual care. Some young people absolutely need that interpersonal contact or to do things in groups with other young people. It also means that youth are more vulnerable right now. I would hate to think that there are people that are preying more on vulnerable people because increased use of social media and internet-based everything. But everyone has to be aware of the fact that there are some predators out there. There are people that are trying to make a buck the wrong way. And it puts youth, especially youth, at risk. Some things that we do need to pay attention to. When school is gone, one of the biggest forms of structure and consistency goes away. So how do we replace that structure and that consistency? And some young people absolutely need that. If they're more distractible, if they're more dependent on the supports of others or the guidance of others. So routine is important, and how can we as family members, as support people, kind of enhance that structure? Sleep, we always underestimate the importance of sleep. A lot of young people are describing sleep concerns during the pandemic, symptom of many mental health concerns. Sleep hygiene is something that we have to pay more attention to. We do know that when you are involved in anything related to a screen, it actually has an impact on the brain where you're more stimulated. So although our use of electronics is increasing, what's the impact on our young people's ability to sleep and have a good amount of sleep? Similarly, we have to look at nutrition and appropriate nutrition, have to look at exercise. All the things that we already know make a big difference become that much more important when we are restricted and we used to take these things for granted. Socialization, how much socialization at a minimum should we have? When we talk about social isolation, can we do it too much? Social distancing, can we do it too much? And again, how do we appreciate the different kinds of needs of different youth in terms of not just the amount, but the format? I was working with youth in a small rural community, and there were probably 10 of them. And they were amazing. And these are all youth with lived experience, and they were amazing. They're incredibly creative. They were emerging leaders, but they started talking about COVID. And one of them said that she was very happy because she was able to be spending more time with her family, and her mother worked really hard, a single mom, and they really appreciated that. And she was really doing a lot to engage with other people. Another young man was saying he's a tech savvy person, and for him, it's like he's landed on his planet. It's perfect for him. His street cred has gone way up because now he knows all the answers for the difficulties that people are having with anything related to technology. But one young woman was saying, I keep reaching out and it's not the same. And I feel horrible and unhappy because I need face-to-face time with people. And you could see that some of her symptoms that she experienced before had been coming back. So when we're looking at changes in someone, what is their baseline? Even if you have a mental health concern or a mental illness, you know what your kind of steady state is. Like I'm someone who has suffered from depression. I know when I'm in another episode. I can know the symptoms. And we need to monitor our symptoms as well. And young people need to monitor their symptoms because they might need a little extra support during this period. And if their need for physical contact, don't underestimate the need for physical contact, not just verbal contact and social interactions. For physical contact isn't there. Communication is also a two-edged sword. I don't know if anyone has Googled COVID-19 lately. I Googled COVID-19 research mental health, and there were like 5,000 new publications, a lot from China because they were ahead of us. How do you sift through all that stuff? And that's the research literature. If you go in the popular literature, you're having tens and hundreds of thousands of things, and there's a lot of crap out there. And things that can increase anxiety and cause misinformation and guide young people towards resources that wouldn't necessarily be helpful. So I think we have to watch information, but in our households, we have to also have some ground rules about communication. How do we talk? How do we talk with our young people? We don't talk to our young people, we should be talking with our young people. And I'm a great believer in the 50-50 rule. If you have an hour with a young person, you only own 30 minutes. They own the other 30 minutes, even if they want it to be silent. So sometimes the best way to talk is to stop talking and listen. So maybe this gives us a chance to spend more time listening than talking. And are we also making an attempt to reach out to those who might be struggling? My guess is a lot of young people know other young people that may have challenges, mental health challenges, other challenges. And that's why I started by saying, are we offering and receiving support? It's not always easy to receive support. It's not always easy to offer support in a way that's not condescending or that still values a person as having all kinds of strength, a strength-based approach to offering supports. So have there been conversations with your youth about how are they reaching out to other youth? Because they actually know who might be more isolated. The parenting piece, I'm really encouraging. I've been talking to parents about trying to get away from the command and control approach to dealing with COVID. You probably sometimes at least feel that the way to cope with this is to isolate yourself and wrap everybody in a bubble. And you kind of set firm limits. That's kind of the command and control. It doesn't tend to work with youth. What does tend to work with youth is co-creation, is negotiation, is risk mitigation. So not everything is as dangerous as other things. So how do youth have a say in terms of the steps that they might take to make themselves safe, even if they aren't exactly the same steps that you might take, and to respect that conversation and that dialogue. So what I've learned over many years working with youth is that if I try to think about ways to solve problems that are going on with youth, I usually fail. When I engage youth in a conversation to co-create solutions and listen to what they have to say and blend whatever experience or expertise that I might have, because I'm really old, and their creativity and their finger on the pulse of what's really going on, the combination of youth that are respected for what they bring, with adult allies that respect their role as a partner in that, that's where you can actually co-create solutions for young people with young people that make sense and are more likely to be implemented and sustained and to the right kinds of outcomes. No matter what we do, and I think a lot of people are trying to do this, as we venture in all kinds of unknowns right now, we really do have to evaluate what we're doing, whether it's making a difference or not. These are the seeds of new systems that are going to evolve. If we don't evaluate, we're not going to be able to do course corrections for what our new normal is going to look like. So I think as the professionals that might be listening, lots of creativity is coming to bear right now. Let's just not have creativity without some rigor to capture the story, to capture the impact, so that we know what works, what doesn't work, and actually what might be doing harm. And then down the road, we can keep things going in the right direction. So with that, I'm going to stop. I don't know how we're doing for time, Kate, if we're approximately where you wanted me to be, but I was told that we want to leave a lot of time for dialogue, conversation, questions and answers. And I'm happy to answer or to try to answer any question or to engage in a conversation. So with that, I'm going to stop. Thank you very much.
Thank you so much, Ian, and thank you for sharing the great resources that if you check your chat box, there are tons of links there that Ian has provided to us. Very useful stuff. Thank you so much for your compelling talk. So before opening the plenary, friendly reminder, please do use a headset if you have one. If you would like to speak, use the participant icon at the bottom of your screen to raise your hand. You can also post any helpful links or comments or experiences you're going through in the chat box. So with that, let's open for discussion.
Okay, so maybe I'll jump in. I'll take CEO privilege here and and take the first one. I have about a million things I'd like to ask you, Ian. But one of the things you talked about at the very beginning was the challenge of traditional systems, and certainly that they're not meeting everyone's needs. And when we were chatting before the session started, you were talking a little bit about integrated youth hubs. And it got me to thinking about, as we move out of COVID, what are the low-hanging fruits going to be to improve on the traditional systems? And out of the same line, I noticed that Sue Bennett was on, and she spoke early on in our sessions about her social pediatric hub in Vanier. And I wondered how that whole concept, and particularly related to your integrated youth hub idea, Ian, and its relationship to mental health might be part of our low-hanging fruit, short-term, immediate, not short-term, immediate solutions.
So I'll just start by saying integrated youth hubs are not my idea. They've been around for a while. They've been implemented in a lot of different countries. It's kind of exploding across the country. And at the basis of it is how can we actually look at young people more holistically and create services that wrap around them, as opposed to trying to get them to fit into our traditional systems. And that's being done with family members, it's being done with youth themselves. They're trying, those that are really doing significant work in this area are trying to learn from what others have done, and on the shoulders of giants, you can see much further. So how do you take all that information so that it can be implemented across constituencies and across contexts? But at the nub of this is looking at the fact that youth are not just mental health problems. Youth have issues around physical health and employability and housing and need for peer support. And there are some, and I'm seeing Hillary Allen online, so Hillary knows this better than I do, having been a champion for this for many years. But you have young people that have a combination of physical health and mental health concerns. Eating disorders are often neglected as a very significant avenue. So how do you look at things and build things so they make more sense, so that young people can easily access them? And right now with COVID, we were talking before about physical spaces, like a one-stop shop where you would go and you would have access to physical health and sexual health, mental health. And now that the virtual hubs are exploding. People looking at all that same combination of resources that might be available virtually, which makes a lot more sense when we think that young people, especially in rural communities, may not have access to a hub. And the hub might be a 2-hour drive away, which may not make sense for some. So I think there's great promise, but we're just scratching the surface of this still, and still learning how it's going to work for the best possible outcomes. but it means that you're not investing in the big, massive kinds of structures and institutions we used to have, but you still need to have links to more specialized care providers like mental health, psychiatry, psychology that might be associated with hospitals. But most hubs are community-based, embedded in the realities of what communities do. And again, Hillary could probably answer this much better than I can, but there are organizations that are trying to learn what we already know and use it better. And one of those organizations is called FRAME, F-R-A-Y-M-E, and it's a network of people trying to get this right.
Well, I guess our experimentation, forced experimentation with coming together digitally is going to make a big difference on a lot of fronts, and the medical front in particular. I mean, even people who are able to get video appointments now with physicians that couldn't before, that would be sitting in waiting rooms. And if you sort of morph that idea onto faster access to mental health supports and the variety of other kinds of support, so that someone isn't in a car going and knocking on a lot of doors, now it's part of a interconnected virtual hub. I think that's really that will be a real benefit if anything comes out of that from this.
Yeah. But we have to be careful because we assume that all youth are tech savvy, and they're not. We assume that all youth are tech comfortable, and they're not. And we assume that technology is everywhere, and it's not. So again, it's not going to be just one solution. It's going to be many, many different solutions. There was a story when telemental health started, they had created hubs in Indigenous communities. So they had all the equipment, and it wasn't being used. And it wasn't until the mental health service provider went to the community and actually met people and then went away again that they started using it. In other words, the relationship is still very important, and how to initiate that relationship. For some people, it's more important than others. There are cultural issues that you have to be aware of as well when even doing virtual care. So I think we're going to learn a lot right now, and we're going to learn hopefully what works best for who, when, why, how, and what doesn't work as well and what we should move away from.
That's great. I see Hillary Allen has her hand raised. So I'm just going to unmute you, Hillary, and you are live.
Okay, thanks, Kate. Thank you, Ian. That was really, really great. My question kind of goes along the lines of what you were just talking about. I just saw one of those numerous polls that you mentioned, and talking about the number of people experiencing mental health issues, and yet only 13% are accessing services. And at the same time, I hear anecdotally that people aren't coming to these virtual services that have been created. So not necessarily a case of not being able to get in the door, it's that they don't like the door, and for all those reasons that you've explained. So I'm just wondering what an organization like Families Canada could do to help encourage them. Like we aren't able to send someone out in the community and develop a relationship at this time, but are there some techniques that are known to work with, communicating with youth and informing them in a way that would be feasible in these times?
Yeah, that's a great question, Hillary. And it is nice to see you. It's been a while.
Yeah.
Nice to see your face. So people are spending a lot of time looking at peer support right now. The peer support world is exploding, and it's peer support almost on steroids, where we realize that peer support can have a lot of credibility and validity and professionalism. One of the trainings I've done recently was to train peer ambassadors who are going to be supporting other youth, but who are linked in a cascading model with various levels of support. So what we learned from YouthNet many, many years ago, we had was called youth facilitators, and they would go out in the community and they were talking with young people, and they were not clinicians, but they were accessible, and young people could identify with them. And if a young person, and they often did disclose things, about 10% of young people were telling us that they were suicidal, for example. And that youth facilitator who had a link to a network of professionals, and I was one of them, the youth that would never in a million years talk to a psychologist would tell me their life story in 10 minutes because they had made a link with this youth facilitator. So we can bridge people through a peer network. We can bridge traditional and non-traditional supports by looking at the power of youth and the relationships that can be built, as long as we're always crystal clear about role clarity, where the handoff is, where the handoff back is. And we have to look at not just stepping up to more intensive kinds of supports, but also stepping down when you've finished seeing the psychiatrist or you've left the hospital because you needed some stabilization. You just go back out of the world with nothing. Well, where's the role of peer support in terms of that step down and creating a bit of a network around the person that might be struggling so they feel more supported? We've seen some of the peer support work being facilitated by technology. There's an app out there called Timsel, was developed by a young man with a significant mental illness who's also a tech genius from the Ottawa area. And it seems to show great promise. And it has peers providing reminders to their peers or who are within their network. It doesn't have to be a peer. It could be family members, a very important role of families, to do things like nutrition and exercise and monitoring symptoms. And what they're finding is not only do they continue using the app, which is unusual. New apps people use for a week and they abandon. Well, with this app, they're using it for 6 months and longer, and they are reaching their goals because peer support becomes a bit of a way to feel that you're not alone as you're making change happen. So I think that's one of the areas, whether it's peer support from parents to parents, families to families, peers to peers, it can be, I think, a huge strength. It's already part of our system. We just don't recognize it enough. Does that answer your question, Hillary?
Yes, that's great, Ian. Thank you.
Okay.
Okay. Unless you have another one handy, Kate, I wanted to switch gears a little bit and reflect on when you, in your presentation, you were talking about the sort of the risks of predatory online behavior. And we work a lot with newcomer families where
Right.
the parents may or may not have English and French. Their personal literacy might be quite low, and their online literacy is probably very low. So from a parenting oversight perspective, it seems to me that there's considerable risk. And, you know, we at Families Canada have been sort of musing about improving, you know, how we can help improve digital literacy generally. But this seems to be a particular area of risk where parents who would provide sort of parent oversight in this circumstance may not be able to, and yet at the same time, the risk levels are probably higher than ever.
Right. So technology is not going to go away. So, you know, encouraging parents to monitor and limit is tough to do, especially developmentally. There are organizations out there that really look at cyber safety. PrevNet is one that has been looking at this for a long time, and I would, from a bullying perspective, especially was what their vantage point was. But I think they have all kinds of good information on cyber safety. Think about this for a second. If you are a young person that's feeling more socially isolated, and people are reaching out to you on the internet, you might think it's a solution. How much of your own information do you share? And what's safe to share and what's not safe to share? We can ask parents to be more savvy about this, but I think part of this is going directly to youth and asking them to help us find solutions to protect not just themselves, but their peers in terms of potential predators, unsafe practices, as well as things that they might be engaging in themselves not knowingly, like online bullying, which people say things online that they would never say in person. It's that brain again, right? That acts before thinking. And once you've typed something, you press send, you can't pull it back. It's there forever. So I think it's a combination of not using scare tactics, not expecting parents to be able to completely control access to every kind of technology. It's not a fair kind of expectation of parents that can create, I think, conflicts, especially when everyone is sharing the same space. But I think that we can be much more proactive in terms of direct information to youth or to youth from youth about how to protect oneself in a society that's going to become more virtual. I saw a question about Timsel. Timsel is Timsle. Someone was looking for the exact spelling for that app.
Great. Thank you, Ian. And we have a question from Zindu. So I will unmute you, Zindu, and you are live.
Thanks, Kate. Thanks, Ian, for a really great presentation and discussion. I was just thinking about a needs assessment that we did at Families Canada recently with our membership. And one of the top issues that is coming to the surface is burnout and compassion fatigue among our service providers. So our organizations who had to really reel and find their footing in this sudden situation. And of course have to draw on their own personal resilience and resources to be able to provide the kind of support that the families are needing at this time. Many of our people on the ground are young themselves. Facilitators are youth who are supporting other young people. So as organizations, I was wondering if you would have any tips or strategies that our organizations could use to help the people who are helping others.
So I have a daughter who works for Air Canada. And she was actually, up until recently, on the very front line, including wheeling people off of planes that had COVID-19. And she's a young person, so she already has an anxiety disorder. Her anxiety was going through the roof. And she also had to earn a living. So I think that there's some things that have happened in terms of subsidies and funds available that have decreased some pressure on certain people. That's great. I think there's been a huge public appreciation for what frontline people are doing, whether it's someone that is working in a hospital or a law enforcement officer or a grocery store clerk or someone selling you coffee at Tim Hortons. So that appreciation is great. I think every member of our society should, with every opportunity, recognize that and comment on that. It doesn't make that stress go away, but does sure make you feel valued. And that your definition of a frontline worker should be very, very broad in terms of those that might be placing themselves at risk for us. Even if you, I think there's a, I don't know how easily this works, but there might be times when someone's working on the front line and the stress is too great. So when is it okay to step away from the front line and take time off, even though everyone's saying you're a hero for doing it? And then I think about if you don't take care of yourself, how will you be able to take care of other people? So sometimes that self-care piece for a frontline provider will not just allow them to keep doing their job if that's what's going to be required, but it might allow them to step away, because if they're healthier, they might be able to go back to work quicker, and if they are healthier, they can support their own family better, their own loved ones, their own circle of supports in a mutual way. It has to be okay to say sometimes, I just can't do it right now. It has to be okay financially, it has to be okay emotionally, it has to be okay in terms of your own sense of self-worth and what you can and can't contribute at any point in time. So that needs to be part of the dialogue as well. We don't want everybody to have to be a superhero every day all the time, because that's really exhausting after a while. So everybody needs to find that right balance in that, and the demands are great. I'm not sure if that answers your question or not, Zindu, but part of it is the responsibility of the individual in terms of how they look at it, what they do for themselves. Part of it is a responsibility for the people around that person and their immediate family to look for signs there might be too much. Part is the responsibility of the employer to be able to have supports available for someone who may not be able to continue in that role, or a role where they may not be as exposed to things that might increase their anxiety. And there's a part for all of society to play in terms of how we recognize it, how we comment on it on a day-to-day basis.
Thanks, that was great. Thanks, that's helpful.
Thank you so much, Ian. We have a question in the comment box from Wanda for you, Ian. What might you suggest to a parent who is struggling to keep their youth indoors to the point where the youth will just go and leave the house? It feels like this conflict was evident pre-COVID. However, as you mentioned, it is now amplified. Yeah.
So, and I've heard this actually a lot. And that's why I started talking about the command and control. There might be things that are impossible for you to do. You can't bar the door and wrestle someone to the ground, because that's going to create other kinds of conflicts. Some young people, even though if they want to get out, they don't think that they're vulnerable, might appreciate that other people might be vulnerable. So how, when they come back, can they protect other people in terms of even socially distance themselves in the house, or washing, or whatever it happens to be, or monitoring symptoms in a different way? It gets back to that risk mitigation piece that I was saying before. That young person may have peers that you're aware of who are being a little more cautious, and they might be able to be helping in terms of enlisting their help to think about different plans so that the conflict around this issue doesn't increase. It might be saying, I understand you have to go out, but what are your friends doing to kind of protect themselves? And in some instances, you might find that they're going out, but when they go out, they're socially distancing and doing all the other things. They're just not following your rule to stay home. So what's the communication about what are they actually doing? And are there little things that could be added? Are they doing enough? And you should respect that and then allow your anxiety to go down a little bit. So I think there's a lot of threads to potentially pull on, but it's trying to get that young person to realize that, yes, they are making decisions for themselves, but these days we're also making decisions for other people all the time, because we aren't completely isolated. We have to still interact with people. So sometimes through communication, that's a possibility. You're not going to have a very productive conversation as the person is leaving the door and you're trying to keep them from going out. That's not the right time to co-create a solution. The time to co-create a solution where things are a little calmer and you can listen and you can say, you know, I was concerned because when you come back, I know that you may have been, I don't know what you're doing, but I'm worried about your little brother. I'm worried about your dad. I'm worried about me. I'm worried about your mom, and I just want to make sure that people are going to be safe. And I wonder if we could have a conversation about how we can make sure that you're safe and we're safe, or at least not worrying about it so much. So it's an invitation to a conversation. You can do everything right, and they can still tell you to go F off. But the approach that you're taking from the get-go, you're not assuming that they're going out looking to get sick and bringing back and making everybody else sick, even though that might be a reality. So talk about it.
Thank you, Ian. So we're coming to the end of our session. We have time for maybe one or two more questions or comments, if there's anyone out there who has some. If not, Ian, would you have any final words of wrap up?
So, I mean, this is Families Canada, and families are having a hard time right now. They want things to go well. They're experiencing more demands, parents especially, more demands than they've ever faced before, in ways that they've never faced them before. And I think that it's really easy to say, be patient, be kind, recognize others. It's really easy to say, it's great that you have extra time with your kids. The reality is we all have to watch out for our own health and well-being. And if we do that individually as members of a family, collectively as families, I think we can get through this much better.
Thank you, Ian, so much. Really helpful and compelling stuff today. That brings us to the end of today's discussion, and I will turn it over now to our Director of Operations, Indu, to wrap up.
Thanks, Kate, and thanks again, Ian, for really great discussion around, I think, one of the most important topics that everyone is facing, especially these days. Like you said, it's amplified. It's been thought-provoking and certainly has raised some red flags that we in the sector need to be aware of and maybe need to think through. But it has also been reassuring and hopeful. So it's been a great way, I think, to end this 10-week series. I would like to thank everybody who has participated. Thank you to Kate for moderating and Kelly for kicking off the discussions and for the presentations as well, for all the guest speakers who came on, but especially to our membership who has been calling in weekly and sharing your experiences and thoughts and comments. It's just been an absolute inspiration to all of us. We will hopefully find another way, another platform to connect again and keep this sort of connection going. We will have a recording of this session as usual on our YouTube channel next week. And I would just like to say that it's been an absolute pleasure to have this journey with you for 10 weeks of Let's Talk. Thank you, everyone, and have a great weekend.